It's Lou here. I just want to briefly talk about an illness that I think needs a lot more awareness about it. A lot of people don't know about it and how severe it actually is and how it can be. If you look at me, I look like a normal 24-year-old girl, but that's not the case. You turn me inside out and you'll be like, oh my god, she's disgusting, even more than she is now. So the disease is ulcerative colitis. You've probably not heard about. You've probably heard a lot more about Crohn's disease. Now, Crohn's disease and colitis kind of go hand in hand. The only thing I know about Crohn's is it affects your full digestive tract, whereas your colitis is your colon. It's your large intestine. Now, my symptoms started like 2 years ago, so I've had it for like 2.5 years, and I was misdiagnosed. I didn't get the diagnosis that I needed, the diagnosis that I should have got. I didn't get the treatment. So yeah, for 2 years I had severe stomach pains, chronic diarrhea, chronic fatigue. I couldn't get out of bed, my bones, my muscles were so painful, and I was passing a lot of blood. So yeah, 2 years this was going on for. The doctor's like, no, you've got IBS. No, I've not got IBS. I mean, you know yourself when you're genuinely not well. So I started passing more blood, I kept being sick, I couldn't keep anything down. So when they eventually sent me to the hospital for a colonoscopy, and it went pretty well, for as well as a colonoscopy can go, I suppose. So it went pretty well, and the results came back that I had colitis. And colitis is you've got an inflamed colon, you've got ulcers in there that are bleeding and they're pussy. It's kind of like, if you think about, if you leave a cut in your body somewhere for too long, the more it's going to fester and get infected, and it's going to take a lot more tender loving care to heal. Well, that's what happened to my colon. It was so much worse because I didn't get the right diagnosis for 2 years. So because I was so ill, I had to get admitted into hospital. Now, I was there for a good couple of weeks, if not longer. I was straight onto a drip because I was so dehydrated. I didn't have any nutrients in my body whatsoever. And then I had to start an immediate course of steroids. It was called prednisolone. Now, I was on them for 6 months to start with. It gets the inflammation down really quickly, and then you have to start your medication. Now, you're on medication for life if you have this disease, and there's no cure for it. So you have to have medication to keep it at bay. You have to go through all these different tablets to find the ones that are suitable for you and to get you into remission. Now, remission means when you have no symptoms of your disease, which I've not got. I mean, I had it for 2 years and I've only got my diagnosis, so I'm like on my 6th month of knowing that I've got it, and it's going to take a while. As I said before, it's like the cut, only it's inside my body. Now, if you have any of these signs, then please go and get it checked out. If the doctor says, oh no, it's IBS, then be persistent that it's not, and if it is, then great. I'm not saying IBS is great. What I'm saying is you're better safe than sorry, because if you leave this, it's going to cause so much more problems. Like, it can affect your eyes, it can affect other organs in your body, and when you've got colitis, you're at a high risk of colon cancer, so you don't want it to find out you've got it and it's too late. So you have to go for regular checkups. And don't be embarrassed, don't be ashamed, because I'm not. And I want people to know that this is why I can't go out as much, this is why I can't do the things that I used to do. And that does happen. It is a life-ruling disease, especially when you've just found out you've got it and you try to get it under control. I mean, 2 years ago, I was so bad. I couldn't even leave the house without having to be in the bathroom 24/7, and it's horrible because you get arthritis. My bones and muscles are constantly sore, and it's just, it's horrific. And if you're working, God's sake, tell your work colleagues. I mean, I know that people don't want to tell people this because it is an embarrassing thing to start with, but it's not. I mean, how can you expect people to sympathise with you about your condition if you don't tell them? And they will come and go with you, they should. They wouldn't punt you out on your arse for having AIDS or cancer, so why should this be any different? Just because you can't see it doesn't mean it's not there. It's an illness. You're ill, and they have to understand that. And tell your friends, tell your family, they will understand. and you'll know who your true friends are. You can't expect everybody to understand your illness, but what you do expect is for them to do the moral thing and be persistent with you, come and go with you, because you are an ill person. I mean, I don't want this. I wouldn't wish it upon anybody, but I've got it, and I'm going to deal with it in every way that I can. And you'll be so tired, but it's not your fault. You have to know this isn't your fault. The peak ages, I mean, you can get it at any age, but the peak ages are between 15 and 25, and I'm 24, so I just made it. Woohoo! It is hereditary, but I have no one in my family who's got it, so I've started a full new generation of colitis. Sorry, kids and grandkids. Yeah, so please just get it checked out. I mean, I was in the hospital the other day because I was having a lot of pain in my abdominal area, a lot of discomfort. And I got a scope down my throat. They're in every orifice, by the way. And yeah, I've got like I think it's a hiatus hernia. And that's caused by many things. You can get that through smoking, being over 50, which I'm not, and I don't smoke. Pregnant women get it, which I'm not pregnant. At least I don't think I'm pregnant. No, not pregnant. So yeah, but it can be caused by other things like straining, like when I had I have got it, but when I didn't get treated, I was constantly being sick. I was constantly having bowel movements, so you're like pushing and it's putting a lot of strain. And it's when your stomach goes up through your abdominal and it causes it a hernia. So yeah, I've got that to deal with as well. I'm going to deal with that. I'm not asking people to cry a river, because you do that yourself, trying to accept the fact you're going to be ill for the rest of your life, you're going to be on medication for the rest of your life. But yeah, I mean, not everybody's ignorant, not everybody's an ass, not everybody thinks it's funny. There is good people out there, and they will understand. You will get the help that you need. And sometimes you have to give in the battle to win the war. And, you know, don't give up. It's the hardest thing not to give up when you've got something like this. It's life ruling, but don't let it do it. Be kind to your needs. You won't be able to go out as much, as I said, but don't overdo it. You know, if your body's telling you something, then listen to it. Get the help that you need. And you will. It'll take a while, but you'll get there. I mean, I'm still thinking to myself, I'm going to get there, I'll be fine. And I know that I will. Because, you know, it's only been 6 months, 7 months. I feel a lot better than what I did. So don't be embarrassed, don't be afraid, don't be ashamed. I'm not. You have to tell people. And don't be afraid to go to the doctors, because people think it's embarrassing. It's a job to them. They see this every day, and it could save your life. I mean, I get told in hospital, if I didn't start my steroids right away, I could have died. And they're not going to tell you that to scare you. They're not allowed. They have to tell you the truth. It's because I was so inflamed. It can rupture. It can cause so much more problems, and you can get cancer from it in your colon. So just soldier on, you know, and you're not alone. And that's probably one of the worst things, to think you're alone with this. You're not. There's other people out there. I'm here if you want to talk. There's other people on YouTube, you know, things like that have got the same thing, and they will help you. And it is severe. It's nothing to just take lightly. You have to get it dealt with. And I'm going to go, because I'm babbling on, and you know, you don't want to listen to it, and I'm not feeling too good as it is now. So yeah, I'm going to just say what I've said, and you know, you'll be okay, I promise. So thanks for listening, thanks for watching, and you'll be fine, I promise. So thanks very much, guys. I'll see you soon. Bye.